Hello, everybody, and thank you very much for joining us for another one of our fabulous educational seminars. Today, we have a special guest who's actually my sister, Dr. Tamara Culnane. She is an anaesthetist, or as they say in America, anesthesiologist, but we don't say that here in Australia. Tamara trained initially as an emergency medicine specialist and worked in that field for a while before then studying in pain management and then settling on anaesthetic as her specialist consultancy. She works in the private and the public system, or has worked in the private and public system, but is currently a private senior consultant. Dr. Culnane mostly does medical negligence work with us, but she's also available to comment on other matters, and she writes a very good and forensic report, if I say so myself. Before I hand over, I'd like to say to everyone, if you could please keep yourself on mute. There will be an opportunity to ask questions at the end of the session. The reason I ask you to stay on mute is so that any noise in your workplace or home doesn't interrupt and impact upon the recording. Within about a day from today, you will all receive an email with a copy of the recording. And of course, it's available on our YouTube channel, which you can all access via YouTube or through the Mag Connect booking platform with your login. Pardon me. The last thing I wanted to say is that today is International Talk Like a Pirate Day. So, ahar, me hearties.
Shiver me timbers.
All right. Without further ado, over to you, Dr. Tamara.
Hello, everyone. Thanks for joining us for this talk. I'll try and keep it to time and try and keep it as interesting as possible. I've always thought that a talk heavy on memes was lacking on substance, but I am trying to jazz up a rather dry topic, the language of medicine. I didn't have a classical education, so I'm not versed in the etymology of the roots of a lot of these words. Obviously, language was developed, as in any profession, to describe, to categorize, to communicate, also to establish a little bit of an elite club and exclude others from information. Therefore, we've got a whole lot of compounded words, eponymous terms, acronyms and abbreviations, and of course, inconsistencies, exceptions to every rule. So I'm going to just talk basically about terms rather than parlance and how you can deconstruct words and find that you're probably much more medically literate than you might assume you are. And like any sort of professional language, there are roots to the words, usually noun-based, prefixes and suffixes, which might be multiple and can serve in various parts of the word. And the words are then connected with vowels or trimming of the root terms just to make it a little bit more palatable to the tongue, but also often more confusing. And then a lot of associated words and qualifying, specifying adjectives. I'm going to just start with one example, the root myo, which means of or pertaining to muscle, and then talk through how some of these words are constructed. So myopathy, pathology, we would be au fait with that word as talking about a disease state or the study of disease, specifically looking at your tissue biopsy under a microscope or your blood test. Myopathy is some sort of disease of muscle. Myocarditis, that term, a second root of cardiology, we'd be very familiar that that refers to the heart, specifically the muscle of the heart, and itis, which we'll see again and again, is just a generic term for inflammation, which can be of any cause, be that infectious, autoimmune, etc. Myoma uses the suffix oma, and that means any sort of benign, generally tumour, can occasionally mean a cancerous tumour or a lump or a collection. Myosarcoma, again, is more specific, oma meaning lump or tumour, but a sarcoma is any sort of tumour that comes from your connective tissues, your bone, tendon, muscle, and cartilage. And cardiomyopathy would be pretty familiar with this word, heart, muscle, disease, and that could be ischemic from blocked arteries, it could be viral, etc. The Cook's tour is about to start, and so I'm going to try and get through this in time. Apologies if I'm a bit quick at times. Bronchitis. Bronchus talks about conducting airways. Itis, again, inflammation. We're pretty familiar. Gastro, gastra, anything referring to the stomach. A scope means to take a view of. And so anything that's a scopy is taking a view of, generally with a camera-based system. And O is simply a linking vowel. Thoracotomy, the thorax, meaning the chest, any part of the chest, thoracotomy. Otomy, that suffix means opening, cutting into, simply opening. So that means opening up the chest, even if that's to have a look or whether that's to do an actual thoracotomy operation. Thoracoscopy, using a camera to scope or to take a picture of the chest. Carotid endarterectomy, a surgery that you might already have a feeling for exactly what that is. Carotid is the Greek word for stupefy, and I will actually stop here and talk about the etymology. That word for the carotid artery stems from their appreciation that if you pressed very, very hard on both a person's carotid arteries, they passed out. Endo. Endo comes from embryological terminology. The terms endo, meso, and ecto are for inner, middle, and outer layers of an embryo that then fold and form the various tissues of the developing body. Endo, artery, cutting out or removing. So it's surgically removing the inner layer of a blocked or partially blocked artery to prevent or ameliorate strokes. Meso, again, middle layer. Thelioma, thelium means layer again, and oma mean a lump or growth or tumour. So this is a specific tissue. We'd be familiar with the dreadful disease mesothelioma from asbestos exposure, where the asbestos finds its way into the connective tissue. So it's different from the other cancers of the lung, which are of the ecto or lining tissue. We're very good at keeping people waiting, doctors. Antiametic, anti, very familiar prefix. Emesis, the state of vomiting. Ic, any agent or process. So an emetogenic agent is something that has the ability to cause the genesis or the beginning or the start of vomiting. Not used so much now, obviously in emergency medicine, used where there is poisoning. Ectopic, ecto means inside, but it has come to really mean anything that's not where it's supposed to be, ectopic. The layer where the pregnancy should implant within the uterus, but an ectopic pregnancy has implanted elsewhere in the fallopian tube, on the ovary, or in the abdomen. Parenteral nutrition, para. Para has a number of meanings or interpretations, but basically here it means adjacent to or outside of, or if you like, abnormal to. Entero, enteritis, we're probably familiar with gastroenteritis, gastro of the stomach, entero of the guts, basically, the bowels. So parenteral nutrition is giving nutrition in general cases intravenously when the enteral or gastric and bowel route is not available. Other examples, and we're familiar with these suffixes and prefixes, sub meaning under or beneath, lingual of the tongue. So a sublingual gland, swelling or tumour. Subcutaneous, cutis, your cuticle, part of your skin. Cutis is often used just to refer to the skin in general, subcutaneous. Pre and postpartum. Parturition is the act of giving birth, and is a throwback to a Latin suffix. Infra and supra. So the glottis is another word for the larynx, specifically where your vocal cords close. So supra or infra meaning above or below the larynx, a swelling, a tumour, etc. Cephal, cephala of the head. So anything that's cephalic means in the direction of the head, if I'm giving a description. Encephalitis, en within, cephal of the head, itis simply inflammation. And mega, in this case used as a prefix and a suffix, megacolon, some sort of enlargement or dilatation of your bowel, and splenomegaly, spleen, a shortening of spleen. Retro, we're very familiar with that. Again, a retrograde, grade meaning direction or slope. Pyelogram, pyelo is referring to the ureter, so connecting between your kidney and your bladder. So retrograde pyelogram is an injection of dye, generally with an X-ray picture. So Anne, again, we're really familiar with this. It's just the root that is maybe less familiar. Anesthesia, aesthetics, beautiful things, the art of feeling or seeing, but in a medical sense, it's any sort of sensory input. So anesthesia, removing the ability to feel, see, and perceive pain so that we can cut your appendix out or whatever it may be. Anemia, and using the root heme, we're familiar with hematology, study of the blood, anemia, and so on, just dropping the H in order to give the word decent prosody. So it's a low red cell count in the blood specifically, but the term itself derives from no or low blood. Analgesia, another root for pain. So an analgesic is something that gives you relief or absence from pain. Transit, we're very, very familiar with that as a prefix. Transurethral, so a cystoscopy looking through the urethra into the bladder. Transcutaneous, again, the skin cutis. Transcutaneous drug delivery, patches for hormone replacement therapy or angina patches, etc. Hypo and hyper, we see this with all sorts of terms, obviously. Calcium, high or low calcium. Emia, without the H. Heme, high or low calcium in your blood. Glyce, for glucose, high or low glucose in your blood. Hyperemesis, hypertension, simply meaning pressure. And on we go. Dys, bad, poor, abnormal or painful. So dysesthesia is some sort of unpleasant or abnormal sensory experience, for instance, experiencing pain or a burning sensation when the actual stimulus is simply touch. Dysphagia, phage is anything that swallows or engulfs in terms of the root. So a phagicide might be a blood cell that acts in an immune sense to swallow or engulf bacteria. Dysphagia is abnormal or difficult swallowing. Odyno, another word for pain, as in analgesia, painful swallowing specifically. And again, dysmenorrhea, meno being one of the roots for the uterus, and rhea meaning for flow or excessive flow in some senses. So dysmenorrhea means painful menstrual flow. Again, these prefixes here, macro, micro, and neo, they're pretty familiar. So microcephaly, again, cephala, the head, a small head, cranium or skull, and neoplasm, new growth, plasma, simply meaning a general term for tissue, and that's really an overarching term for any sort of tumour. And again, going back to oma, we've seen the word adenoma for a gland. Glia is a term for neural cells that could be within the brain, the spinal cord, or the nerves. So it's some sort of tumour of a nerve or in the brain. Osteo, pretty familiar, osteoporosis, osteo of bone, osteoma is a tumour of the bone. And again, we've seen earlier genesis pertaining to the formation of something, a metagenic, and of course carcinogenic, something that has the potential to cause a cancerous tumour. So there are so many words there that use that root heme, just with that dropping of the H often, and with linking vowels. Hematology, the study of or tests pertaining to hematuria, the urine, blood in the urine. Hematoma, simply a lump of blood, a bruise. Hemoptysis, ptysis being a word for sneezing or coughing, but in this sense it's generally used to talk about coughing up blood rather than sneezing blood. Anemia, and we talked about glycemia. Anything pertaining to the abdomen can have the root lap or lappa. So a laparotomy means simply a generic term for opening up of the abdomen, and it's often an umbrella term, particularly when you're doing that in an exploratory sense, when you don't know what you're going to find or what you're going to do. Laparoscopy, taking a view of, generally with a camera, and shortening to lap. Lap hernia, lap coli. Coli being a word for the gallbladder, the cholecyst or cholecystitis, inflammation of your gallbladder, lap coli. One of the words pertaining to kidney is neph or nephro, nephra, nephrostomy. Generally, that means radiologically imaging the kidney in order to create a hole into the kidney through the back when the draining system of the kidney is obstructed. Nephrectomy, the kidney, and ectomy, like appendicectomy, cutting out a kidney. And nephrosarcoma, specifically a connective tissue tumour involving your kidney. And here, just some more examples using those suffixes and prefixes, al or ic, epidural, the dura are the connective tissue lining surrounding your brain and spinal cord, letting them float in your cerebrospinal fluid. Enteric, we talked about entero. Osis is just another sort of general word for any sort of disease. Osteoporosis is porous bone disease. And itis, we've talked about. Gram, any sort of picture, a picture of the electrical activity of your heart, an ECG, an angiogram, a picture of the open or otherwise state of your blood vessels. Tomy, tome is a word for cut, and it can refer to a cutting instrument, the actual act of performing a cut. An osteotomy is simply cutting a bone, perhaps to realign it. An osteotome is the machine that will do that for you. And a dermatome, dermatologist, the skin. A dermatome is a special machine that will take a slice of your skin in order to do a skin graft elsewhere. Malacia, softening of anything, softening of your bones, softening of your brain, which you may be feeling at this point during this talk. Algia is a word, again, like odino, analgesia, algia for pain. Arthralgia, arthritis. Arthralgia is pain of your joints. Myalgia, pain of your muscle, it's lost that O. And neuralgia, pain generally relating to nerve dysfunction rather than talking about pain in a nerve itself. So we've talked a bit about some of those terms, oma and tome and stoma, and with the linking vowels and with the dropping off of consonants, a lot of these things can be a little bit hard to tease out. Just looking at those things there and thinking about what would you do? Would you download an app to talk about medical terminology? I've had a look at a great many of them, and I don't think they're a terrific idea. Mostly, you know what, Dr. Google, once you realise that you know most of what that word is going to get you to a reputable site that will explain what that particular route is and give you some information about it. Of course, there's lots of duplication, lots of exceptions to rules. The word gravida means full or pregnant, and the word para means the number of pregnancy. So there's a scoring system in obstetrics. You might say G4 para 3. That means you have been gravid or pregnant 4 times and you've had para 3 pregnancies that have survived to a live birth. So that might indicate that someone had had a miscarriage. And again, para also has that related meaning of being outside, or para 2, like a live birth is outside its mother. Parasternal, adjacent to your sternum. All sorts of terminology relating to wandering uteruses. Hyster, metra, utra, meno are used in a lot of terms that will relate to the female reproductive system there. Myometrium being the muscle layer, endo inside, the inner layer. Hysterectomy is obvious. Hysteroscopy is pretty obvious. Menorrhagia, excessive menstrual flow. And again, duplication in words for the kidney or parts of the urinary system, nephro, renal, urological, and pyelo, more specifically the ureter. Eponymous terms, they've got to go, and they are going. Unfortunately, a lot of them still remain. A lot of them are quite familiar to us, so perhaps it's not such a big problem. We'd be familiar with Down syndrome when in fact it's really trisomy 21. Soma in that case is a word for body. It can be nerve cell body, the body in general. In this case, it means the body of the chromosomes. So it means that of the 21st pair of your 23 plus sex chromosomes, there are 3 instead of 2. And Turner syndrome, a disease that only occurs in girls where instead of having 2 X chromosomes in the sex pair, they have a single X. Crohn's disease, most people would be familiar that that's a form of inflammatory bowel disease as opposed to syndrome. And Alzheimer's disease with the other dreadful name, senile dementia, which is really a bit not PC. And there are so many pieces of equipment, types of an operation, ways of doing things that have eponymous names that it's a little bit unfortunate. I mean, my eponymous dream is to invent something that takes about 2 cents worth of plastic to make and be called Dr. Culnane such and be sold in a surgical sense for about $300 a pop, but we'll move on. And some of these diseases, I mean, hereditary hemorrhagic telangiectasia is a really good descriptor. It's inherited hemorrhage, it's bleeding. Telangiectasia a little bit more obtuse, but that is talking about ange, blood vessels, ectatic, growing out. So it's little fluffy blood vessels within your gut that bleed rather than having that difficult eponymous name. Obviously, we have a bucket load of abbreviations, and a lot of these would be quite familiar. Triple A, abdominal aortic aneurysm, atrial fibrillation, body mass index, inflammatory bowel disease as opposed to irritable bowel syndrome, liver function tests, magnetic resonance imaging, CAT scan, other things that we will use in our notes, right upper quadrant, left lateral, all sorts of descriptors of direction and place and position. In prescribing, there is a huge move amongst health care regulatory bodies in Australia for us to stop using the sort of PRN, pro re nata, I don't even know, but that means as you need. QID apparently means 4 times a day, TDS apparently 3, and I don't know the Latin derivation of that. And they're difficult and they're prone to misinterpretation and errors. We do often use in our notes symptoms, presenting symptoms, diagnosis and treatment, just as abbreviations that we are familiar with. And there are other useful things like the APGAR score, which uses those general words rather than more significant things to give a good prognostic score on newborns. I'm not even going to read the chemical name for diazepam, but you can see why they have a name that is contracted. And then, of course, there's the confusion of multiple trade names. And propofol, the drug that killed Michael Jackson, but which I happily use daily in a safe setting. The one thing about anaesthetists is they often say we're not people. I am a people person, but I do always win. Just in closing, again, there's no reason not to simply Google this terminology, and as long as you're careful with what you look at, I mean, even a lot of the, Mount Sinai advertising obstetric practices that have their wonderful websites full of information, they're going to give you very, very good and general information about these terms. The etymology sites, I think, are really of academic interest, and that's why I really haven't touched on any of that today. I did use this book, Mastering Medical Terminology, which gives a quite useful way of looking at those things, but probably only 25% of it is useful. The rest of it talks about stuff that's more of interest to nursing and medical students as they go on. So look, I hope that has been helpful, and I hope you realise that you're probably much more medically literate than you might imagine. Another thing I haven't been able to really touch on because of time constraints is the general parlance and the way we tend to put things together, and some of the wonderful expressions we have, many of them now quite politically incorrect, for us to be able to discuss things and give a sense of meaning to our colleagues, whilst not perhaps revealing something to patients and those around us. And that's probably the more interesting thing, but it's very hard to unpack that and put that on slides in this setting. I hope you've enjoyed this, and it hasn't been 30 minutes of your life you feel you'll never get back. Thanks for listening, and I hope to talk to you on perhaps a less dry subject at some other stage.
Thank you, Dr. Culnane. That was actually very interesting. I have a question before I open up to everybody else from someone who couldn't attend, and they wanted to know laminectomy.
Okay.
Where that's from.
Yes. So lamina, if you think about something that's laminated, like your bench top, etc., just meaning layer or applied layer. So a laminectomy is looking at the layer of bone at the back of your spinal cord. So the bone of your spinal cord has this very solid vertebral body at the front, and then behind that there's a ring of tissue which surrounds the spinal cord, which is dangling down there in its bag of dural connective tissue and cerebrospinal fluid. And the nerves emerge through that ring of bone, and muscles and so on attached to that ring of bone. And when you do have, for instance, pressure on your spinal cord or nerve, which is often from the discs in the front part between the vertebral bodies pressing backwards, one way to release that pressure is to ectomy, remove, surgically cut out the lamina at the back, which are sort of almost tile-like at each level of the vertebra. They're almost tile-like flaps of bone that overlap and allow a certain amount of movement, flexion, and rotation. And you can excise part of those parts of the lamina to actually give more room for the spine or the nerves to move back and relieve that pressure.
Lovely. Thank you so much. And just from Brett in the comment, I enjoyed your sense of humour thrown into the mix. Great memes. Thank you. And a couple of other thank yous. And then we have another question from Claire saying, similar question, arthroplasty.
Yeah, so arthro, if you think of arthritis, you'll come to realise that that's something to do with a joint. Plasty, if you think of plastic reconstructive surgery. So not talking about cosmetic surgery, but the true plastic reconstructive, which is changing the shape of in order to reconstruct or do something. So an arthroplasty is going into a joint and in some way changing its shape or fixing it up in a manner that's not just, for instance, using its natural anatomy. So that might mean debriding or shaving off cartilage that's causing a problem, or removing spurs of bone that are causing some limitation of movement of that joint. Or it might mean actually something coming closer to a joint replacement. And then you can talk about a hemiarthroplasty or a total arthroplasty. When you think of a joint like the knee, you might have very much wear and tear on the upper surface of cartilage and bone, and you might do a hemi-half arthroplasty and replace that with titanium and all sorts of wonderful things. Or you might do a total arthroplasty, in which case both the top and the bottom of the joint get some sort of titanium and other prosthetic material put in to give that joint function and reduce pain.
Cool. We have a, here we go, another thank you. That's very interesting and informative. And then we have a question, is there a formal way of referring to a viral reaction?
Not really. And I mean, often we talk about infection and people talk about infectious disease, and there really isn't anything more specific other than saying, for instance, viral meningitis as opposed to bacterial meningitis, or viral cardiomyopathy as opposed to cardiomyopathy from ischemic heart disease. So there really isn't. I mean, it is a really, really important distinction clinically in terms of what we can do and what we should and shouldn't do. But there isn't really any other sort of suffix or prefix or other part of the word that will determine that.
She's just put in a correction. So you've given us extra information there. The correction says, sorry, a viral reactivation.
Oh, okay. So a viral reactivation is something like shingles. And there aren't really a whole lot of diseases that do this, that have an ability to lie dormant. And tuberculosis can do that, but that's not a viral disease. So shingles, good old chicken pox, it actually likes to, after your initial illness, remain dormant in what are called the dorsal root ganglia, which are the little back sensory part nerve roots that I talked about that are emerging from your spinal cord and elsewhere. And it can be there for decades. And then at some stage, just with minor fluctuation or a significant deterioration in your general immune status, that virus can reactivate. And in that case, it won't cause the initial disease with the skin rash and a febrile illness. It will then cause a neuritis. So it will inflame that nerve itself. And that's why people get that terrible nerve pain. And they will then get vesicles only in the skin distribution of that nerve. I mean, there isn't really any other term for that. And there aren't many diseases that are capable of causing that sort of that sort of reactivation, but it just does mean anything that has been dormant and not at all active, you know, which we're hoping we'll see less and less of shingles with young people having been vaccinated and older people getting vaccinated.
Fantastic. There's been a couple more thank yous. Does anyone else have a question? You can either unmute yourself and ask your question, or you can type it in the chat. Lovely. Awesome. Look, Tam, thank you so much for making time for us today. It's been a pleasure. Also been nice to see my sister, who lives all the way away in Melbourne, and I'm in Sydney. We really do thank you for your time. That has been very informative. We're getting more thank yous in the chat. Thank you, everybody, for making your time to join us as well. And we look forward to seeing you in our next seminar. Dr. Tamara is actually going to do a seminar on anaesthetics, what can go wrong with anaesthetics, and why doctors choose particular types of anaesthetic. So we'll let you know when that one's coming on. Thanks, everyone, and have a great rest of the day.
Thank you. Bye.
I'm going to stop the recording.